Let us discuss about atherosclerotic aneurysm. See, the name itself indicates the aneurysms is due to atherosclerosis. Okay, due to formation of atherosclerosis, that this results in aneurysm. See, as all of us know, what is aneurysm? It is abnormal permanent dilation of blood vessel or wall of heart, right? And is called aneurysm. See, the reason why there occurs aneurysm in the atherosclerosis is, see, this is wall of blood vessel. Okay, this is lumen. Whenever there forms aneurysm, the blood supply to the media will decrease. The distance that blood has to pass through this to reach media will increase. Hence, there will be less nutrition, less oxygen to the media. Okay, this results in thinning and destruction of elastic tissue present in the media. It results in thinning and destruction of elastic tissue that is there in the media. This results in atrophy. Okay, this results in atrophy media, and this ultimately leads to weakening of blood vessels, and then there to aneurysm. Okay, there to aneurysm. This is basic mechanism that is involved in formation of atherosclerotic aneurysm. And if we take histology, how it looks. See, in the histology we can see fibrosis in the media and adventitia. This fibrosis is present in the adventitia and media, right? Sometimes this fibrosis may extend into intima also. Okay, and there may be remnants of atherosclerosis in the intima. Okay, there may be remnants of atherosclerosis in the intima. Then this is histology. See, then coming to morphological features. The most important site of this atherosclerotic aneurysm is abdominal aorta. See, abdominal aorta is the most common site. It may involve other sites also, but the most important site and the most often we find this in the abdominal aorta. Okay, in the abdominal aorta also, the site where it is present is, this is aorta, this is renal arteries, and this is bifurcation of aorta, right? So these aneurysms are present below the origin of renal arteries and above the bifurcation of renal arteries. See, bifurcation of aorta. Okay, above the bifurcation of aorta and below the origin of renal arteries. It is the site of atherosclerotic aneurysms, and this mostly seen in the age above 50 years and mostly in males. And this is the measurements of these aneurysms are 5 to 6 centimeters in diameter. Shape of this aneurysm is in most of the time it is fusiform. And sometimes we may find mural thrombi. In the aneurysm. Okay, most of the time we find thrombi in the aneurysm. Okay, and then coming to complications or effects of this aneurysm, this atherosclerotic aneurysm. The most important complication is rupture. Okay, rupture is the most important complication, and the risk of rupture, it depends mainly on the duration of aneurysm, and BP of or blood pressure of patient. Okay, these are the two important risk factors that may develop rupture of this atherosclerotic aneurysm. And this rupture, whenever there is rupture of aneurysm, blood, as I told you, this is most commonly found in the abdominal aorta, right? So whenever there is rupture, this rupture results in seepage of blood into the peritoneum. Okay, peritoneum or retroperitoneum, and this results in sudden hypotension and shock, right? This results in shock. Okay, and these ruptured aneurysms are most likely to get infected. most likely to get infected. This is about the rupture. And then coming to compression, this is also one of the complication of atherosclerotic aneurysm, compression. And we mainly focus on the aneurysms that are present in the abdominal aorta, right? So whenever there is aneurysms or atherosclerotic aneurysm in the abdominal aorta, it compresses. One is ureter, most likely to get compressed is ureter, and the second one is vertebrae. Okay, there is compression of vertebrae. This results in erosion of vertebrae and compression of ureter. And the third is arterial occlusion. So there the third complication is arterial occlusion. So this arterial occlusion, it mainly occlude inferior mesenteric artery. Okay, most of the time it as it is present in the abdomen, it may likely to get compressed inferior mesenteric artery. Okay, inferior mesenteric artery. Okay, this is about the complications, and this is something about atherosclerotic aneurysm. Thank you for watching.